You're listening to Parents You've Got This, the expert guide to parenthood. Your complete guide to pregnancy, birth, baby and parenting. Join us for the journey.
This week's episode is all about preparing for pregnancy, and we interview our IVF and fertility expert, Dr. Rachael Knight, all about optimising our diet and lifestyle to prepare for having a baby. Dr. Rachael Knight is from Life Fertility Clinic Melbourne, and she is a fertility specialist and a gynaecologist with more than 20 years experience. She is also a reproductive endocrinology and infertility expert, and she comes to us today with advanced expertise in all manners of fertility and trying for a baby. Thank you so much for being with us today, Rachael.
Thank you so much, Christy and Freya. It is an absolute pleasure to be here, and I'm delighted to talk about fertility, nutrition and preparing for a pregnancy. I feel that this is an area that is just not talked about or covered enough.
It's not, and we are just so grateful to have you here today to share all this information with people so that we are really well informed when we start our journey towards parenthood. So let's start by talking about nutrition. What are the things, Rachael, that we can be doing and be mindful of when we're thinking about our nutrition in this important sort of phase?
It is really important to start thinking about your nutrition, thinking about vitamins, and thinking about your lifestyle at least 3 months before starting to conceive. The development of the egg in our ovaries starts at least 2 to 3 months before it is released. And it is important to get our bodies right pre-pregnancy, just as important as during pregnancy, and also important after pregnancy, which is something many people don't think about. It is very important, however, it is also quite straightforward. What we are talking about is not rocket science. We don't have to search into the Amazon for that really elusive, particular fertility supplement that is going to change the world. This is just healthy eating. The diet that has been recommended for people who are planning a pregnancy and who are wanting to optimise their fertility has been studied, and a number of studies have found that a Mediterranean style diet is the best diet to promote fertility. And this is very, very simple, balanced, healthy diet. There's nothing magic. It is fresh fruit, fresh vegetables, simple meats, avoid high processed meat and a lot of extra sugars. So meat, fish, grains, fruit and vegetables. Put another way to ensure that at least half of the food on your plate at any one time consists of fruit and vegetables. There are other do's and don'ts, and there are a number of other things that have been studied from a fertility perspective. People have looked at diets that are high in sugars, high in processed meats, and these diets have been shown to disrupt someone's hormone processes, ovulation, and lead to a lower chance of successful pregnancy. So we've followed this further as well and found that IVF success rates can be reduced if someone is significantly overweight or you're not following an appropriate lifestyle or diet.
And so how long do we need to be mindful of having a healthy diet? How long do our nutritional stores last?
Well, that can vary from person to person, so it is important to keep this diet and healthy lifestyle up for those at least 3 months before starting to conceive, and during the early conception phase, pregnancy as well, and throughout any treatment if you are needing to undergo fertility treatment. There are a number of other factors as well, things such as smoking, alcohol, and other sort of lifestyle factors, vaping, recreational drugs. It's important to look at all of these aspects as well prior to trying to conceive.
Can you tell us a little bit more about those? So about the health and the lifestyle factors. So, we know the things that are bad for us, but what are the things that we might be doing just naturally that we think are healthy that actually might not be conducive to having, that optimal environment for fertility?
Yes, so there are a few things that is a bit of a trap, and it's easy to fall into sort of what we think might be sort of healthy eating, but still realise that then it's not necessarily supporting our general health. For example, reducing sugars is very important. Sugars are very sneaky, and people hide sugars in a number of different foods. Even having a fruit drink has very high sugar levels, and this leads to a burst in our insulin, and if taken regularly can disrupt our hormone levels and lead to a disruption in ovulation. So just being mindful of those hidden sugars. Fruit drinks, as I said, is one. Energy drinks, the supplements are another. So it's important to look for those hidden sugars. There was also a study that was done looking at low-fat dairy, and particularly for women, we feel that that's good for us. We don't want to eat too much saturated fat, which of course is a good principle to follow. However, there were studies that associated low-fat dairy products with a lowering in fertility rates. Full cream or full dairy is probably a better option when you're trying to fall pregnant.
And does this also for male and female? When you're talking about this, should the male have the same emphasis on his diet and lifestyle as a female?
Absolutely. Different, however. The factors that can affect male fertility are some of the obvious ones. Things like smoking will lead to at least a 30% increase in the delay to conceiving. Will also lead to more abnormalities in semen analysis, as will alcohol intake, and cannabis use as well has been found to be associated with abnormalities on semen analysis. And while that's not necessarily common, it's not uncommon either that people do use these sort of recreational drugs. So these are things that really do need to be eliminated, and as the life cycle of the sperm is 72 days from when the sperm is produced to when it is released, there does need to be at least 2 to 3 months prior to conception that these things are introduced. There has also been found to be some benefit from supplements for men as well, and research in particular has looked at a number of supplements including zinc, selenium and other antioxidants such as coenzyme Q10 or ubiquinol. And these vitamins, supplements have been shown in limited studies, but shown to have some benefit in men's fertility. On top of that, obesity is a big problem, and having an elevated weight, which is a term I prefer to use than obesity due to some of the negative connotations, is important, and it can affect both female and men's fertility in different ways, but it is still an important factor. So healthy eating isn't just the important part of the equation, trying to maintain or aim for a healthy weight range is important. And we find that rates of conception are higher, rates of fertility treatment, including IVF, can be reduced and reduced quite significantly if people are carrying that extra weight. So I feel as a fertility specialist, it's very important to assist people. And there's no benefit in telling someone to go away and lose weight, because that's never going to work. These patients and clients need to be supported as much as possible on this journey, and weight loss may be part of that in conjunction with other aspects of our fertility treatment. And we do that through the advice of fertility diets, the assistance of a fertility dietitian, and if really required, maybe even a fertility doctor or surgeon to assist in that avenue.
We wanted to ask Rachael about exercise and other elements of healthy living that you might encourage in this period, like getting good sleep, and what are some of those key other sort of lifestyle factors that people can control and can really easily implement to maximise their chance of falling pregnant?
Yes, regular exercise is important, and the recommendations for exercise are between 150 to 300 minutes per week. Now, it is important to continue with exercise while you are trying to conceive, and also when you are pregnant as well. It isn't the case that you need to stop exercise, wrap yourself in cotton wool. You don't even need to curtail your exercise program necessarily. And reviewing the evidence on this, and this is supported by the guidelines of the Royal College of Obstetricians and Gynecologists that give us guidelines for pregnancy care, that continuing with a regular healthy exercise program is important. And if you are already doing regular exercise, it is supported and recommended that you continue with that exercise. Now, there are a few caveats on that. If you are thinking about taking up exercise, then that should be done in conjunction with a healthcare professional. For example, it's probably not a good idea to suddenly start running or doing strenuous exercise as a first off while you're trying to conceive or in early pregnancy. And obviously some extreme sports may need to be curtailed just due to the excess risks, but exercise is a good thing.
And what about prenatal vitamins? When should we be taking these?
Prenatal vitamins, again, because of the development of eggs and sperm, ideally 3 months before we're starting to try and conceive, throughout pregnancy, and also throughout the breastfeeding phase as well. So many women find that they are taking these vitamins for years.
Yes.
And now, the vitamins, I know they're horse tablets. They are very difficult to swallow sometimes. You can often get the key ingredients in a smaller tablet. So it is important to talk to your doctor. But the main vitamins that we recommend pre-pregnancy include folate, and folate needs to be at least 400 micrograms. Most of the prenatal vitamins have 500 or 800, but it is worth double checking. And the reason for folate is that it reduces the risk to the baby of having a condition called a neurotube defect. And a neurotube defect is where the baby's spinal cord doesn't develop properly and is left exposed and causes issues to the baby once they're born. So folate is very important. The other important aspects are iodine, iron, vitamin D, and there's a fair bit of evidence in the studies that being low in vitamin D and low in iron can reduce your chances of successful conception. So supplementing those things are important. And there's been a lot of work over the last few years around probiotics, and I'm now recommending, based on still some fairly early work, but in the absence of a probiotic really doing any harm, a probiotic that is high in lactobacillus, which is the sort of healthy bacteria we have in our bodies, particularly in our reproductive tract, has been shown to have a positive outcome on conception. And all of these things do make us feel a little bit better along the way. I'm often asked about other supplements as well. Now, there are a number of supplements that have got some limited research to support them, but sometimes in specific areas. Things such as DHEA, which is a precursor to a male hormone. However, while that might sound a bit strange, even for women, those male hormones are used to make the female hormones. So sometimes that can be useful. And it tends to be more useful in the studies that we have done in people that are lower in egg numbers, or possibly, unfortunately, even starting to run out of eggs. So we do find that can help in that particular situation, but it probably doesn't help everybody.
An important question, Rachel, for many men and women is, what about caffeine? Is this something that we need to look at changing up when we're thinking of having a baby, or are we okay to keep drinking coffee in our usual regular coffee habits?
Absolutely brilliant question, and it is very important, caffeine. We do have evidence and more in pregnancy that caffeine may result in an increased risk of miscarriage, and high caffeine intake has had that association. So while we recommend that you don't have to completely eliminate caffeine, reducing caffeine is helpful. And the recommendations are that it's reduced to less than 200 micrograms per day, which is probably the equivalent of one coffee. I tell my patients, just make it a good one.
You need one, at least one.
Just make it a good one. And make sure that you look at other caffeine containing drinks. So tea, any energy drinks, a lot of supplements, and it can sneak its way into food. It's another sort of very sneaky thing that is put into a number of drinks and foods that we eat. So important to look at that as well.
Well, thank you so much, Rachel. It was so lovely to have you on the podcast this week. Next week, we are delving even deeper into fertility, and we have our IVF and fertility expert, Dr Rachael Knight from Life Fertility Clinic, to talk to us all about optimising our fertility.
Thank you so much for having me here today. It's been a pleasure.
A big thank you also to Mistela for sponsoring this episode. You've been listening to the Parents You've Got This Expert Guide to Parenthood podcast. Never forget, parents, you've got this.
You've been listening to Parents You've Got This, the expert guide to parenthood. You've got this parenting gig.